According to a new study led by a UCLA Health researcher, pregnant women whose household tap water had higher levels of lithium had a moderately higher risk of their offspring being diagnosed with autism spectrum disorder. The study, published in the journal JAMA Pediatrics, is believed to be the first to identify naturally occurring lithium in drinking water as a possible environmental risk factor for autism. Any drinking water contaminants that may affect the developing human brain deserve intense scrutiny, says the researcher. In the future, anthropogenic sources of lithium in water may become more widespread because of lithium battery use and disposal in landfills with the potential for groundwater contamination. The researcher says that the results of this study are based on high quality Danish data but need to be replicated in other populations and areas of the world. Because of lithium's mood stabilizing effects, some lithium compounds have long been used as treatment for depression and bipolar disorders. However, there has been debate about whether mothers can safely take lithium during pregnancy amid increasing evidence it is associated with high risk of miscarriage and cardiac anomalies or defects in newborns. The researchers analyzed the lithium levels in 151 public water works in Denmark, representing the water supply for about half of the country's population. To identify which waterworks supplied mothers' homes at the time of their pregnancy, the researchers used address information from Denmark's comprehensive civil registry system. Using a nationwide database of patients with psychiatric disorders, the researchers identified children who were born in 1997 to 2013 and compared 12,799 diagnosed with autism against 63,681 children who did not have an autism diagnosis. The researchers also controlled for maternal characteristics, some socioeconomic factors, and air pollution exposures, all of which have been linked to increased risk of autism in children. As lithium levels increased, so did the risk of an autism diagnosis, the researchers reported. The researchers found a similar relationship between increased lithium levels and a higher risk of autism diagnosis when the data were broken down by subtypes of disorder. They also found the association between lithium levels and autism risk was slightly stronger for those living in urban areas compared to smaller towns and rural areas. In addition to Denmark's comprehensive civil databases that have proven to be valuable resources for public health researchers, several other factors made Denmark ideal for this study. Denmark's consumption of bottled water ranks among the lowest in Europe, meaning Danes largely rely on tap water. The country also has a robust system for measuring trace metals and other contaminants in their water supply. Lithium levels in Denmark's water, when compared to other countries, are likely in the low to moderate range.